Today's world is more interconnected than ever. People and pathogens can move across the globe in hours, and these pathogens don't necessarily arise naturally.
There's also deliberate man-made pathogens that could be extremely dangerous.
Biological threats, epidemics, pandemics threaten not just the health of individuals, families, and communities, but also are incredibly burdensome to economies.
Over the last 15 years, we've seen repeated important international epidemics rise without warning.
What we need is leadership on this question of pandemic preparedness, and we need champions for it.
You have to have uniformly strong global health preparedness at every country level, because the weakest link is the one that will be exploited by a pathogen.
The insecurity starts from one place, and if you don't take care of it, then it spreads and becomes a global problem.
In 2014, we had an Ebola outbreak in Western Africa, and very quickly it became a global problem. That was a wake-up call.
The world really needed to understand where there were gaps in preparedness for biological threats.
If we can help to create a measurement tool, that gives political leaders and policymakers an enormous advantage in actually addressing those problems.
The Global Health Security Index is the first assessment of 195 countries' capabilities to prevent, detect, and respond to biological threats.
This is a very comprehensive tool that can help identify the areas where each specific country needs to work more in order to reduce the gaps.
So the index asks about 140 questions in a variety of major categories, including a country's commitment to international norms, its health system preparedness for epidemics, and its risk environment for the onset of natural or deliberate biological risks.
The index was created by 3 organizations: the Nuclear Threat Initiative, the Johns Hopkins Center for Health Security, and the Economist Intelligence Unit.
It was really important in the development of the index to have international input from leading experts in the field.
The international panel included 21 international experts from 13 countries, from a wide variety of perspectives.
We're taking a comprehensive view of both the factors that enable an effective response to disease outbreaks to prevent them from becoming epidemics and pandemics, as well as the inherent risk factors.
And so the index constitutes the first globally available set of numbers that can be used to assess where they are and how far they need to go to get better prepared.
The index is also really important for other sectors. International organizations, academic experts, nonprofits, philanthropists, all of the different sectors that really need to understand where the gaps are in the world's preparedness for biological threats.
The index can help the philanthropy sector decide where to invest. We can catalyze change in areas where governments may not choose to venture.
We are all in this together. We are indeed in a race between cooperation and catastrophe.
We are all part of the globe. So if countries are not doing what they should do, then of course the globe cannot be secure.
This is an effort to stop unnecessary death and deal with threats to human welfare and human health.
Working together, we can all prevent outbreaks from becoming global catastrophes.